Miss Olson, if you want to have a seat right here. And do you prefer to be called Miss Olson or is Brittany okay?
Brittany's fine.
Brittany, hi Brittany. I'm Natalie. I'm an occupational therapy assistant student with Austin Community College. How are you doing today?
I'm lovely, thank you.
Good. Well, I know that you have recently had a right wrist fracture and you are on the road to rehab according to your doctor, and you've discontinued your splint use. Is that correct?
Mm-hmm.
How do you feel with the splint off?
I feel great. I mean, it's hard to get used to without it being on because I'm so used to it on there now, but I'm kind of excited to go into the next step. Yeah.
Are you feeling any pain while you're using your right hand?
Yeah, every once in a while, depending on how I use it, a little bit, yeah.
A little bit. If you had to put it on a scale from 0 to 10, 0 being no pain at all and 10 being at your worst pain, how do you feel?
Right now, it's about a 2.
A 2?
Mm-hmm.
Okay. Today we are going to do a reassessment using the 9-hole peg test, which I believe you've done before, just to kind of see if there's any improvement with your fine motor skills and eye-hand coordination. It shouldn't cause any further pain, but please let me know if you do notice some discomfort, okay? We just kind of want to reassess your dexterity to see if we need to update any goals. I know that you are eager to get back to independently performing your self-cares, and I see cooking and painting are two of your favorite activities. So we'll begin with the 9-hole peg test reassessment, and then I will instruct you on a home care program that you could do to kind of work on getting some more joint mobility.
Okay.
I will be reading the instructions, even though I know that you've done this before. Shall we begin?
Yeah, no problem.
Okay. Now we have this pegboard right here,
Okay.
and I'll put these pegs on your right side. And you can always use your left hand to stabilize the board. Okay. So we'll do a practice test first, Brittany, if that's okay.
That's fine.
You'll pick up the pegs one at a time using your right hand. Place them in the holes until all 9 holes are filled. Then you can go ahead and remove them all one at a time and just place them right here.
Okay.
The pegs can be placed in any order. This is just a practice test. Do you have any questions?
No.
Okay, you ready?
Mm-hmm.
All right.
I can go.
Great. How did that feel?
Good. Feels
Good.
slow, but
That's okay. Did you notice any pain in your wrist?
no.
That was just a practice test, so we're about to do the timed one. Just want to make sure you can just have your feet flat on the floor and sit straight up, nice and tall. Perfect. That might help with the next round, I guess I should say. Are you ready to take the actual test?
Yes.
This one will be timed. You're still going to do the same thing. You're going to pick up the pegs one at a time and place them in the hole with your right hand. Place them in the holes until all of them are filled, and then remove them one at a time and place them right here. The pegs can be placed in any order. I'm going to start the stopwatch as soon as you touch the first peg.
Okay.
So begin when you're ready. which is an improvement from the very first time you took this test. You had completed it with your right hand in 4 minutes. So
Wow, that's an improvement.
yes, very good. You are definitely on the road to recovery. I will go ahead and collaborate with the OT with these results so that we can update your goals. But before we wrap up, I'd like to instruct you on a home care program that you can do on your own time to kind of help increase mobility in that wrist. Of course, the doctor said you can start using gentle active range of motion exercises within pain tolerances. So please, if you notice at any time while you're doing this that you're feeling some pain, go ahead and stop and take a break, and you could resume the repetitions at a later time, okay? I'm going to go ahead and demonstrate first, and then I'll have you give it a try, okay? We're going to want you to do 10 repetitions 3 times a day of just some bending of your wrists. So just make sure that you stabilize your forearm, and then just kind of have your wrist with the thumb facing up, and you'll bring your wrist towards you and bring it out away from you. Now that considers 1 repetition. So 1, 1, 2, 2. You want to go ahead and give that a try?
Sure. Doesn't matter which way I go, I can go the other way.
You can go either way, whatever feels most comfortable to you.
1, 2, 2.
Very good. How did that feel?
Good, it didn't hurt. I mean, yet.
Well, that's good. We want you to do 10 repetitions 3 times a day. So something easy to remember is kind of doing it with your meals.
Okay.
Breakfast, lunch, and dinner. We're going to want to see you again at the end of the week to see how you did with your home program. Let us know if you noticed that you felt more pain or if you felt that maybe it was helping you. And at that time, we'll discuss modifying your goals so that you can get back to independently dressing yourself and doing all your self-cares, as well as hopefully getting you back to painting and cooking again. Do you have any questions for me before we wrap up?
No, I feel good.
Good. Well, I was just about to ask, is your pain level still about the same? You had mentioned a 2?
Yeah, it doesn't, maybe it's gone up to a 3 a little bit, but I mean,
Okay.
other than that, it's still pretty
We just want to be
similar.
wary of that, and we're just doing gentle exercises so that we don't re-injure yourself. We don't want to stress out that
I
wrist.
think it's the most I've used it in a while.
Well, I very much appreciated working with you today. Thanks so much, Brittany. I look forward to seeing you again on Friday. You can just speak to the receptionist to see what times are available. Okay? You have a good rest of your day.
All right, thank you. You
Thank
too.
you.
Bye.